So that's a really topical question about how do we stage patients with systemic AL amyloidosis, and there are a number of different staging systems that are used, and they use 3 different biomarkers. So we think of the traditional 2 cardiac biomarkers, NT-proBNP and cardiac troponin, and also in the Mayo classification we have the dFLC, which is the difference in the involved and uninvolved free light chain. And these models were created in a treatment era which was kind of now historic, so in a different time period, and with regimens that are not commonly used to date. And we've looked at bortezomib uniformly treated patients in the UK at the UK National Amyloidosis Centre, and found when we re-evaluate these prognostic markers, the cardio biomarkers, the NT-proBNP and the troponin, remain significantly prognostic. However, it appears the dFLC does not appear to be significantly prognostic. And this may well be related to the treatment regimens we currently have. And we know that those who achieve deep responses, so those that achieve complete responses, it appears that the baseline dFLC is not important for predicting survival. That may be the explanation of why the dFLC appears to be less prognostic in the current treatment era.